Depression, major depressive disorder. Depression is more than just feeling sad or having a bad day. It's a serious mental health condition that affects how a person feels, thinks, and handles daily activities. People with depression often experience a deep sense of sadness or hopelessness that lasts for weeks, months, or even years. They may lose interest in activities they once enjoyed, feel tired all the time, and have trouble sleeping or concentrating. Depression can also manifest physically, causing aches, pains, and digestive problems without a clear physical cause. The exact cause of depression isn't known, but it's believed to result from a combination of genetic, biological, environmental, and psychological factors. It's important to understand that depression is not a sign of weakness or something that one can simply snap out of. It's a medical condition that requires treatment, which may include therapy, medication, lifestyle changes, or a combination of these. Recognizing the symptoms of depression early and seeking help can significantly improve the quality of life for those affected. Support from family and friends, along with professional treatment, can make a huge difference in managing this condition. Click subscribe to this channel to get more topics you love. Anxiety disorders. Anxiety disorders are a group of mental health conditions characterized by excessive fear and worry. These feelings can be so intense that they interfere with daily activities. There are several types of anxiety disorders, including generalized anxiety disorder, GAD, panic disorder, and social anxiety disorder. Generalized anxiety disorder, GAD, involves chronic, excessive worry about various aspects of life, such as work, health, or social interactions. This worry can be difficult to control and often comes with physical symptoms like restlessness, fatigue, and muscle tension. Panic disorder is marked by sudden, recurrent panic attacks. These are intense episodes of fear that come on quickly and reach their peak within minutes. Symptoms include a racing heart, shortness of breath, and a feeling of impending doom. Social anxiety disorder is characterized by an intense fear of social situations. People with this disorder worry about being judged, embarrassed, or humiliated in social settings. This fear can lead them to avoid social interactions altogether. Anxiety disorders can stem from a mix of genetic, environmental, and psychological factors. Treatment often involves therapy, such as cognitive behavioral therapy, CBT, which helps people change their thought patterns. Medications, like antidepressants or anti-anxiety drugs, can also be effective. Lifestyle changes, such as regular exercise, good sleep, and mindfulness practices, can help manage symptoms as well. Bipolar disorder. Bipolar disorder is a mental health condition characterized by extreme mood swings that include emotional highs, mania or hypomania, and lows, depression. These mood swings can affect sleep, energy, activity, judgment, behavior, and the ability to think clearly. Mania is a state of heightened energy, activity, and euphoria or irritability. During a manic episode, individuals may feel overly confident, talk rapidly, and engage in risky behaviors like spending sprees or reckless driving. They often have a decreased need for sleep and may become easily distracted. Hypomania is a less severe form of mania. It involves similar symptoms but is not as extreme and doesn't lead to significant problems in social or work settings. Depressive episodes in bipolar disorder are similar to major depression, with feelings of sadness, hopelessness, and a loss of interest in most activities. These episodes can lead to trouble sleeping, appetite changes, and thoughts of death or suicide. The exact cause of bipolar disorder is unknown, but it is believed to involve a combination of genetics, environment, and altered brain structure or chemistry. Treatment typically includes mood stabilizers, antipsychotic medications, and psychotherapy. With proper treatment, many people with bipolar disorder can manage their symptoms and lead productive lives. Schizophrenia. Schizophrenia is a severe mental disorder that affects how a person thinks, feels, and behaves. People with schizophrenia may seem like they have lost touch with reality, which can be distressing for them and for those around them. The symptoms of schizophrenia are typically categorized into three major types: positive, negative, and cognitive. Positive symptoms include hallucinations, seeing or hearing things that aren't there, delusions, strongly held false beliefs, and thought disorders, unusual or dysfunctional ways of thinking. Negative symptoms refer to disruptions to normal emotions and behaviors, such as reduced speaking, lack of pleasure in everyday life, and difficulty beginning and sustaining activities. Cognitive symptoms involve problems with attention, memory, and executive functions, like planning and decision-making. The exact cause of schizophrenia is not known, but it is thought to be a combination of genetic, brain chemistry, and environmental factors. Treatment usually involves antipsychotic medications, which can help manage symptoms, and various forms of psychotherapy to support the individual's ability to function and improve their quality of life. Obsessive-Compulsive Disorder, OCD. Obsessive-Compulsive Disorder, OCD, is a chronic condition where a person has uncontrollable, recurring thoughts, obsessions, and behaviors, compulsions, that they feel the urge to repeat over and over. Obsessions are intrusive and unwanted thoughts, images, or urges that cause significant anxiety or distress. Common obsessions include fears of contamination, aggressive thoughts, or a need for symmetry and order. Compulsions are repetitive behaviors or mental acts that a person feels driven to perform in response to an obsession. These behaviors are meant to reduce the anxiety caused by the obsessions or to prevent a feared event. Examples of compulsions include excessive hand washing, checking things repeatedly, or arranging items in a specific way. The exact cause of OCD is not fully understood, but it's believed to involve a combination of genetic, neurological, behavioral, cognitive, and environmental factors. Treatment often includes cognitive behavioral therapy, particularly a type called exposure and response prevention, ERP, and medications such as selective serotonin reuptake inhibitors, SSRIs. Post-traumatic stress disorder, PTSD. Post-traumatic stress disorder, PTSD, is a mental health condition that can develop after a person is exposed to a traumatic event, such as combat, a natural disaster, a car accident, or sexual assault. PTSD can cause intense, disturbing thoughts and feelings related to the trauma long after the event has ended. Symptoms of PTSD are generally grouped into four categories: intrusive memories, recurrent, unwanted distressing memories of the traumatic event, flashbacks, or nightmares. Avoidance, avoiding places, activities, or people that remind one of the traumatic event, and avoiding talking or thinking about the trauma. Negative changes in thinking and mood, negative thoughts about oneself or the world, feelings of hopelessness, memory problems, difficulty maintaining close relationships, and lack of interest in activities once enjoyed. Changes in physical and emotional reactions, being easily startled or frightened, always being on guard for danger, self-destructive behavior, trouble sleeping, irritability, and overwhelming guilt or shame. PTSD is believed to stem from a combination of inherited mental health risks, life experiences, and the way the brain regulates chemicals and hormones in response to stress. Treatment options include psychotherapy, such as cognitive behavioral therapy, CBT, and eye movement desensitization and reprocessing, EMDR, as well as medications like antidepressants. Attention Deficit/Hyperactivity Disorder, ADHD. Attention Deficit/Hyperactivity Disorder, ADHD, is a neurodevelopmental disorder that affects both children and adults. It is characterized by patterns of inattention, hyperactivity, and impulsivity that interfere with functioning or development. Inattention symptoms include difficulty sustaining attention, making careless mistakes, not following through on tasks, losing things frequently, and being easily distracted. Hyperactivity symptoms include fidgeting, inability to stay seated, excessive talking, and an inability to engage in quiet activities. Impulsivity symptoms include difficulty waiting for one's turn, interrupting others, and making hasty decisions without considering the consequences. The exact cause of ADHD is not known, but it is believed to involve genetics, brain structure and function, and environmental factors. Treatment often includes behavioral therapy, educational support, and medications such as stimulants and non-stimulants to help manage symptoms. Autism Spectrum Disorder, ASD. Autism Spectrum Disorder, ASD, is a developmental disorder that affects communication and behavior. ASD is known as a spectrum disorder because there is wide variation in the type and severity of symptoms people experience. Core symptoms of ASD include social communication challenges, difficulty with back-and-forth conversations, reduced sharing of interests, and challenges in understanding relationships. Repetitive behaviors, repeating certain behaviors or having unusual behaviors, intense interest in specific topics, and a need for routine. Sensory sensitivities, unusual reactions to sensory inputs such as sounds, lights, textures, and smells. The exact causes of ASD are not fully understood, but it involves a combination of genetic and environmental factors. Early diagnosis and intervention are important for improving outcomes. Treatment often includes behavioral therapies, speech and language therapy, occupational therapy, and sometimes medications to manage specific symptoms. Eating disorders. Eating disorders are serious conditions related to persistent eating behaviors that negatively impact health, emotions, and the ability to function in important areas of life. The most common eating disorders include anorexia nervosa, bulimia nervosa, and binge eating disorder. Anorexia nervosa is characterized by an intense fear of gaining weight, a distorted body image, and severe restriction of food intake. People with anorexia often have extremely low body weight and may engage in excessive exercise. Bulimia nervosa involves episodes of binge eating followed by compensatory behaviors like vomiting, fasting, or excessive exercise to prevent weight gain. This cycle of binging and purging can lead to severe medical complications. Binge eating disorder is characterized by recurrent episodes of eating large quantities of food, often quickly and to the point of discomfort, followed by feelings of shame, distress, or guilt. Unlike bulimia, binge eating is not followed by purging behaviors. The causes of eating disorders are complex and include genetic, biological, behavioral, psychological, and social factors. Treatment typically involves a combination of psychotherapy, nutritional education, and medical monitoring. In some cases, medications may also be prescribed to address underlying mental health issues. Borderline Personality Disorder, BPD. Borderline Personality Disorder, BPD, is a mental health condition characterized by intense emotions, unstable relationships, and a distorted self-image. People with BPD often experience severe mood swings and a deep fear of abandonment. Key symptoms of BPD include emotional instability, intense episodes of anger, depression, and anxiety that may last only a few hours to a few days. Unstable relationships, alternating between idealizing and devaluing others, leading to tumultuous relationships. Distorted self-image, a fluctuating sense of self-worth and identity. Impulsive behaviors, risky activities such as excessive spending, unsafe sex, substance abuse, or binge eating. Self-harm and suicidal behaviors, engaging in self-injury or having frequent suicidal thoughts or attempts. Chronic feelings of emptiness, feeling empty or bored for long periods. Intense fear of abandonment, efforts to avoid real or imagined abandonment, which can lead to frantic actions. The exact cause of BPD is not fully understood but is believed to involve genetic, brain structure and function, and environmental factors, such as childhood trauma. Treatment often includes psychotherapy, such as dialectical behavior therapy, DBT, and cognitive behavioral therapy, CBT, which help individuals manage their emotions and improve relationships. Medications may also be used to treat co-occurring conditions like depression or anxiety. Substance use disorders. Substance use disorders, SUDs, occur when the recurrent use of alcohol or drugs causes significant impairment, such as health problems, disability, and failure to meet major responsibilities at work, school, or home. SUDs can range in severity from mild to severe. Common substances involved in SUDs include alcohol, tobacco, cannabis, stimulants, e.g., cocaine, methamphetamine, opioids, e.g., heroin, prescription pain relievers, sedatives, hypnotics, or anxiolytics, hallucinogens. Symptoms of SUDs include cravings, intense urges to use the substance, loss of control, using larger amounts over a longer period than intended, neglecting responsibilities, failing to meet obligations at work, school, or home, social or relationship problems, continuing to use despite causing problems in relationships, risky use, using the substance in dangerous situations, tolerance, needing more of the substance to achieve the same effect, withdrawal, experiencing symptoms when not using the substance. The causes of SUDs involve a combination of genetic, environmental, and psychological factors. Treatment often includes behavioral therapies, counseling, medication-assisted treatment, MAT, and support groups. Recovery is a lifelong process that requires ongoing effort and support. Dementia, including Alzheimer's disease. Dementia is a general term for a decline in cognitive function severe enough to interfere with daily life. Alzheimer's disease is the most common type of dementia, accounting for 60 to 80% of cases. Dementia affects memory, thinking, orientation, comprehension, calculation, learning capacity, language, and judgment. Symptoms of dementia include memory loss, especially recent memories, but also older memories as the disease progresses. Difficulty with communication, struggling to find the right words or understand what others are saying. Disorientation, getting lost in familiar places, not knowing the date or time. Difficulty with complex tasks, trouble managing finances, planning, or problem solving. Personality changes, becoming easily upset, suspicious, or withdrawn. Alzheimer's disease is characterized by the accumulation of abnormal protein deposits in the brain, including beta-amyloid plaques and tau tangles, which disrupt cell function and eventually lead to cell death. There is no cure for dementia, but treatments are available to manage symptoms. Medications can help with memory loss and behavioral changes. Supportive care, cognitive therapies, and lifestyle changes can also improve quality of life. Early diagnosis and intervention are crucial for managing the progression of the disease. Somatic symptom disorder. The symptoms of somatic symptom disorder are not intentionally produced or faked. The distress they cause is real and can significantly impact a person's ability to function. People with SSD often feel misunderstood and may become frustrated with the medical system when no clear physical cause is found for their symptoms. Treatment for SSD typically involves a combination of approaches. Cognitive behavioral therapy, CBT, helps individuals change the way they think about and react to their symptoms, reducing the anxiety and distress associated with them. Medication, antidepressants or other medications may be prescribed to alleviate associated symptoms of anxiety or depression. Regular medical follow-up, establishing a strong, supportive relationship with a healthcare provider can help manage symptoms and reduce unnecessary medical interventions. Stress management and relaxation techniques, practices such as mindfulness, meditation, and yoga can help reduce overall stress levels. Dissociative disorders. Dissociative disorders involve a disruption or discontinuity in the normal integration of consciousness, memory, identity, emotion, perception, body representation, motor control, and behavior. These disorders are often linked to trauma and can significantly impair daily functioning. Types of dissociative disorders include dissociative identity disorder, DID, formerly known as multiple personality disorder. DID is characterized by the presence of two or more distinct personality states or identities that control an individual's behavior at different times. People with DID may experience gaps in memory and a sense of detachment from themselves. Dissociative amnesia, a person with dissociative amnesia cannot remember important personal information, usually related to a traumatic or stressful event. This memory loss is too extensive to be explained by ordinary forgetfulness. Depersonalization/derealization disorder. This disorder involves ongoing or episodic feelings of detachment or being outside oneself, depersonalization, and/or a sense that the world around is unreal, derealization. The exact cause of dissociative disorders is not fully understood but is believed to be a psychological response to trauma, particularly during early childhood. Treatment often includes various forms of psychotherapy, such as trauma-focused therapy, helps individuals process and integrate traumatic memories. Cognitive behavioral therapy, CBT, aids in addressing the negative thought patterns associated with dissociation. Medications. While there are no specific medications for dissociative disorders, antidepressants or anxiolytics may be prescribed to treat co-occurring conditions like depression or anxiety. Schizoaffective disorder. Schizoaffective disorder is a chronic mental health condition characterized by symptoms of both schizophrenia and mood disorders, such as depression or bipolar disorder. This means individuals experience psychotic symptoms, like hallucinations or delusions, alongside mood disorder symptoms, like depression or mania. Symptoms of schizoaffective disorder include psychotic symptoms, hallucinations, hearing or seeing things that aren't there, and delusions, strongly held false beliefs. Mood disorder symptoms, depressive episodes, feeling sad, hopeless, or losing interest in most activities, and/or manic episodes, feeling extremely energetic, euphoric, or irritable. The exact cause of schizoaffective disorder is unknown, but it is thought to result from a combination of genetic, biochemical, and environmental factors. Treatment usually involves a multifaceted approach: medications, antipsychotics to manage psychotic symptoms, mood stabilizers for bipolar symptoms, and antidepressants for depression. Psychotherapy helps individuals understand and manage their condition, develop coping strategies, and improve social and occupational functioning. Supportive services, community support programs, vocational rehabilitation, and family education can be crucial in managing the disorder.